Dr. Brevis,
right here,
Dr. Longus,
here,
Dr. Magnus,
right here,
Pectinius,
right here,
Asius,
here,
Sartorius,
here,
Rectus femoris,
right here,
Iliac crest,
right here,
Gluteus medius,
here,
Tensor fasciolata,
right here,
IC band,
right here,
greater trochanter,
right there,
trochanteric bursa,
over the top of it,
sacral crest,
that's right in here,
PSIS,
right there,
gluteus maximus,
right here,
ischial tuberosity,
right there,
sciatic nerve,
right here,
hamstring muscle group.
right here. Next we'll do active range of motion. I'll have her stay on her stomach and do hip extension. First I have her demonstrate it, and then do it with this, do it again. She's at about 12, which is the normal range of 10 to 20, and then I'll have you flip over. Then I'll do hip flexion, so I'll have you demonstrate. Then I'll do it again, do to back up. She's at about 123, which is the normal range of 120 to 130. Now I'll do hip abduction. So go like this, and then have her demonstrate. So bring your foot out here. Do it again, so bring it back out. She's at about 44, which is just under the normal of 45. Now we'll do adduction, so I'll remove this leg to make more room. Then demonstrate, bring your foot out here. All right, I'll do it with this. You can do it again. She's at about 31-ish, so it's just over the normal of 30. Next, I'll do hip internal rotation, so I'll come to the end of the table. And then, so for hip internal, I'll have you bring it out here. And then do it again. So she's at about 45, which is normal, 45 degrees. So then I'll do external rotation, bring your foot in. And then do it again. She's at about 49, which is really close to the normal of 50. I'll have you lay back down, and now we'll go into passive range of motion. Oh, for the active range of motion, internal external rotation, I should have put a bolster under her knee, but I didn't because I forgot. So first we'll do hip flexion for passive range of motion. So I'll go like this, straight leg, should have a firm end feel, and then we'll do bent leg. This should have a soft end feel. Have you flip over, we'll do hip extension. So again, we'll do straight leg. That should have a firm end feel. We'll do bent leg. That should also have a firm end feel. I'll have you flip back over. Next, we'll do adduction. So I'll have you bring this foot over. And just go like this. Should also have a firm end feel, and then I'll have you lay on your side. And then we'll do abduction, which is just like this, also a firm end feel. Next, you can come to the end of the table. And we'll do external rotation, so I'll just hold here. Firm end feel. Internal rotation, also firm end feel. That's all for passive range of motion. So if you lay back down, we'll do manual muscle testing. First we'll do hip flexion with straight leg. So I'll stabilize here, bring her leg up, push against my hand. So I test bilaterally on all the manual muscle testing, but we're not gonna do that. She had full strength, 5 out of 5, and straight leg is testing rectus femoris. So next, Have her bend her knee, stabilize here, and then lift it up, and then push against my hand. She had full strength, 5 out of 5. This one's testing the iliopsoas. So I'll have you flip over so you can do hip extension. So we'll do straight leg. I'll hold here, bring it up, push against my hand. She's full, 5 out of 5, and this one's testing the hamstrings. So then I'll have you bend your knee, and then bring it up, and then push against my hand. She's full strength, 5 out of 5. This one's testing the gluteus maximus. So I'll flip back over. We'll do adduction. Actually lay on your side for this one. So I'll have you do, we'll do abduction first. So start here, push against my hand. This one, she's full, 5 out of 5. This one's testing gluteus medius and minimus. So then for adduction, like this. Then do the same thing. Push against my hand. This one's testing the adductor group, which is the pectineus and the gracilis. Now if you come to the end of the table, and then she needs bolster under her leg. So for internal rotation, I'll just hold here. You push against my hand. This one's 5 out of 5. She's full strength, and it's testing adductor group, which is medial, hamstring, and the gluteus medius and minimus. Next, we'll do opposite. So we'll do external rotation. Push against my hand. This one's the external rotator group, which is the gluteus maximus, sartorius, biceps femoris, and piriformis. So that's all for manual muscle testing. So now we'll do special tests. You lay on your side, and then this one's the iliac crest compression. I'll just push down, and if there's pain in the SI joint, it's just SI ligament irritation or sprain. Have you lay on your back.
Oh.
Next, we'll do the anterior distraction test. So I'll just put my hand on her ASIS and push down and outwards. If there's pain in the SI joint, it's again a SI ligament sprain or irritation. Next, I'll have you come to the end of the table with your legs hanging over. Put my arm underneath it, and then just press down right here. And if there's pain when I apply pressure, it's a possible femoral neck stress fracture. So now have you come back down here, lay on your back. Next, we'll do the hip scoring test. So if you go like this, and then I'll apply axial pressure as I bring it internally or externally rotated and internally rotated. And for that one, if she has pain or symptoms in the hip, there's a possible defect to the cartilage of the acetabulum or a labral tear. So next I'll do Faber test. Just want to have you cross your leg over. Hold here, and then I'll just press down slowly. And if there's pain or I can't push it down to the same level, then she has limited hip mobility due to iliopsoas spasm, or she has SI joint dysfunction. Next, we'll do Gainesland. So I'll have you lay on your side, and then have your lower knee brought up. Gotta stand on the other side. Bring your leg back, and if there's pain in the SI joint. She has SI joint pathology or L4 nerve lesion. Next, I'll have you stay on your side. Hips and knees extended. And then I'll stand behind you and hold here. This one I'll abduct and extend, and then slowly let it adduct. And for this one, if it doesn't go all the way down or her pelvis moves, then she has tightness of the IT band. So next I'll do Thomas Kendall test. Have you come down to the table, pull your knee to your chest, and then lay it down. For this one, if her upper leg doesn't touch the table, then she has tightness of the rectus femoris, and if her lower leg doesn't go straight down to the ground, then she has tightness of the iliopsoas muscle. Next, I'll do Ely's test. So if you flip over, and for this one, I'll hold here and grab here, and then just bring her leg back. And if she can't bring her leg all the way up, or her hip flexes while her knee flexes, she has tightness of the rectus femoris muscle. Next, we'll do Trendelenburg. So I'll have you stand up. So should have both hands on her hip, but I only have one hand. And then stand on one leg. And if her hip drops on the side with her leg up, then she has weakness of the gluteus on the opposite side. Next, we'll do a piriformis test. So I'll have you lay on your side, and then flex your knees and hips to 90 degrees. Stabilize here. Go here. Actually, I'll have you scoot this way a little bit more. And then push down. If there's tightness or pain in like her thigh or gluteus, she has piriformis syndrome. Next, I'll do neurovascular testing. So if you lay on your side, test side up, both hips and knees flexed, and then her head slightly flexed too. I should be on the other side for this one though. So for this one, I'll have her keep her knee flexed, but I'll bring her leg back as far as it'll go. You can relax. For this one, if there's pain or paresthesia in like the lateral thigh area, she has nerve root impingement of the L2, 3, and 4 region. Next, I'll do hamstring tendon reflex testing. For this one, just put my finger here and tap. Oh, yeah, flex your knee. For this one, it's pathological reflex of L5 and S1 nerve root is medial hamstring, and then lateral hamstring is pathological reflex of S1 and S2 nerve root, and if it's bilateral, then it's upper motor neuron lesion, and if it's unilateral, then it's lower motor neuron lesion. So next I'll do dermatomes and myotomes. So for L1, it goes through here, and that one would be hip flexion for myotome. L2 goes here. This one would also be hip flexion. L3 goes down here. That one is knee extension. L4 comes down to the big toe. This one would be ankle dorsiflexion. L5 comes down here in between the first and second metatarsal. This one's great toe extension. And then S1 is down here. This one is ankle plantar flexion, and then S2 is in the back of the gastroc to the heel, and this one's knee flexion. So then for reflex testing, L1 through L5 would be patellar tendon. So I would come down here and just tap here, And then S1 and S2 is Achilles tendon reflex, and I'll go here. And that is all.